Hi, thanks for joining today on the topic of should I see a therapist? So, if you're watching or reading this, then chances are there might be some questions you have that may guide you towards either seeing a therapist or deciding right now might not be the right time for you to see a therapist. So, our world has developed a stigma that seeing a therapist is kind of like admitting to mental health problems. We have a pressure to feel put together and look put together. And going to therapy is admitting we have problems. I hate to tell everyone this, but everybody has problems. It's sad to know that sometimes people with mental health are thought to be weak, crazy, lazy, disorganized, dramatic, unloved, dwell on our problems, can't make decisions, uh, we're volatile in bad relationships, but that stigma is not true. Uh, Therapy is not the only service people avoid or second guess about engaging in. Now, I don't like doctors at all, and I tend to want to avoid doctors unless I'm forced to go by families or if things get really severe. I like to think I've worked on that, and I'm currently better at seeking support in a preventative way these days and less about when the water spills over and needs immediate attention. But a lot of people have that, and the doctors, well, one I think a lot of people can relate to. Now, seeing a therapist doesn't mean you're broken or less of a person. People get support for many things in life, and therapy is one of them. Any person in the civilized world could be diagnosed with a mental health disorder at many parts of their lives. The difference could be a slight change in intensity or how long the symptoms may last. It may be that certain remedies or ways to work through symptoms were passed on from others and their environments, or that they were left finding ways to deal with them yourself. One thing I do believe in is that people do the best with the things and the tools that they have been taught or learned. Now, there's no time frame for anyone. Some people can benefit from therapy long term, others it's short term. But again, that's not any different than any other profession. So when you go to therapy, it's important to know that many times it is short term work, or it lasts a few months or more. Every situation is different. Therapy should be tailored towards your immediate needs and can be a service you go to at different times in your life. Some people may need services longer than others, but that's no different than any other professional service: doctors, specialist trainers, chiropractors, physical therapists, and the list goes on. Now, if you are in crisis and feeling unsafe, you should not only reach out to a therapist, but also reach out to the police, go to your nearest emergency room, or call the Suicide Prevention Lifeline, 800 273 8255. Now, it may take some time to consider before you decide if you're ready for therapy. You may want to wait and see if time, lifestyle changes, or the support you have in place of friends and family can improve whatever you're struggling with. You may also consider therapy if you experience any of the following emotions or feelings. To the extent that they interfere with life, therapy may help you reduce their effects. It's especially important to consider getting help if you feel controlled by the symptoms or if they could cause harm to yourself or others. Feeling overwhelmed. Everyone has felt overwhelmed before. You might feel like you have too many things to do or too many issues to cope with. You might feel like you can't rest or even breathe. Overwhelming stress can lead to serious physical health concerns. Feeling fatigue or loss or lack of energy. Fatigue can indicate depression. Fatigue can cause you to sleep more than usual or have trouble getting out of bed in the morning. Rage, anger, resentment. Everyone feels angry at times. Even passing rage isn't necessarily harmful. Seeking support to deal with these feelings may be a good idea when they don't pass, when they persist, or they're extreme compared to the situation. Or if they lead you to take a violent or potential harmful actions, harmful to yourself or others. Anxious or intrusive thoughts. It's normal to worry about things from time to time, but when worry takes up a significant part of your day or starts to cause physical symptoms, you may want to look at that. Apathy, so losing interest in usual activities in the world around you or life in general. Hopelessness, losing hope or motivation, or feeling as if you have no future can indicate depression or another mental health condition. Feeling hopeless from time to time, especially after a period of difficulty, isn't uncommon, but when it persists, it may lead to thoughts of suicide or substance use. Um, difficulty using substances, behaviors, gambling, pornography, or sex to cope, regulating emotion difficulty, performance at work or school declines, any changes in your sleep or appetite, or if you've experienced trauma. So we've gone over some reasons people may seek support in therapy. Let's go over a few ways therapy can help. Therapy does not just help with ways to cope or deal with stressors and emotions. It does provide a lot of different ways to address those, but that's not the only thing it's for. Therapy allows a private and confidential space to talk about your thoughts, events, stressors, relationships, and emotions without being judged. It's a space to support you with both setting and achieving goals, a place to explore and get to know yourself better, and to work on ways of having a more fulfilling relationship and a more fulfilling life. So thank you for joining me on this video, and I hope the rest of your day goes well.